Now, speaking of myths, we're going to debunk some more. Do you know 200 million people live with urinary incontinence? Not a fun thing, I would suspect. But there's a lot of myths about it. So luckily we have Dr. Jessica Baugh with us.
That's all right.
From Mountain Valley Regional Rehabilitation Hospital. You're a physical therapist.
Yes.
And you know about this stuff.
Learning.
Yeah, well, and you know, people, like I say, 200 million people, and I don't know how much they know about their problem, but there are a lot of myths that abound about this. First of all, tell us what is UI/POP.
So simply put, urinary incontinence, UI for short, is basically the loss of control of one's bladder. And pelvic organ prolapse, or POP as therapists tend to call it, affects 94% of women, and that is when the organs such as the bladder and the uterus descend into and sometimes through the vaginal canal. And that can lead to a lot of discomfort, more urinary incontinence symptoms, and an inability to be independent with toileting and other activities.
Yes, I say, not to mention extreme discomfort in terms of, you know, just living your life. So the myth on this is this is normal. This is normal. Is this normal?
Absolutely not.
Oh.
Men and women get it. Children, teens, the elderly. Doesn't matter if you've had a child, you can have urinary incontinence. Now, obviously, as we age, our risk factors can increase, but that doesn't mean that my grandmother has any reason to be more incontinent than me. In most cases, it is treatable, manageable, and even curable.
Well, and that is like very, very good news, I'm sure, for these people. I have had friends who've had this, and I mean, one was so funny, and I've been thinking if I should tell the joke on air, but maybe I shouldn't. But it is very, very uncomfortable. You mentioned not everyone just, you know, because we think of it with women who've had children because everything gets messed up in there, you know, to carry a child and give birth. And so, but again, you just pointed out that is a myth, that it's normal. It happens to all kinds of people. Now, another myth is that surgery is necessary. True? False?
False. Research lately is showing that physical therapy actually is an appropriate and should be the first line of treatment, because oftentimes causes of incontinence, it could be as simple as a medication you're taking, constipation, dietary changes. Are you a smoker or are you overweight? Those can lead to that. And then surgery isn't or shouldn't be an option, just lifestyle changes or physical therapy for exercises, things like that. First, surgery should be a last case scenario.
Kidding. And do you see this over at Mountain Valley Regional Rehabilitation Hospital? You see people who come in with like big cases, and then you do physical therapy with them, and what happens? What do you see? What do you see with this?
Improved quality of life. People go out with their friends again. They're not hiding in their homes. They aren't getting up more than twice at night to go to the bathroom, so they're sleeping throughout the night. Less rushing to the bathroom, less fall risk, and just, again, quality of life is huge for these clients.
Well, exactly. So this can actually, you're seeing this actually, the physical therapy part of it, actually fix urinary incontinence. Wow, that is phenomenal, because I think, you know, when you're grocery shopping and you go past that aisle, it's like, just don't look at the diapers, you know. I mean, seriously, what a tragedy and a difficulty for 200 million people, and that's probably a low number of people
Probably.
who have it.
The sad part is, though, 10% of people in that group of urinary incontinence clients actually address it with their physician, and even fewer seek treatment because it's taboo. Nobody wants to talk about this. It's embarrassing.
But we're talking about it on TV,
That's right.
Jessica. So it is no longer taboo, you guys. Because people need to know about this.
Absolutely.
I mean, there's things that I think people probably, you know, whether they're old wives' tales or I don't know, but how about if you, like, don't go to the bathroom when you feel like you need to and you wait, does that make your bladder stronger so that you won't have urinary incontinence?
A little bit of both. So some people need to wait to go to the bathroom depending on what their symptoms are, because they might go to the bathroom every 15 minutes and we want to prolong that. But other people, if you hold it, if you're holding it all day, you're just creating a stagnant pool of urine in your bladder, and it's going to cause worse problems.
It's bad. Well, and pardon me for bringing up pets, but I know that some people think, oh, my dog can go for 10 hours without needing to go out. It's like, well, it actually hurts your kidneys too, though, when you, because those are toxins your body is eliminating.
Exactly.
So not a good idea.
No.
But obviously, okay.
In most cases.
So let's say that someone does have a prolapsed, what? Say it.
Pelvic organ prolapse.
Thank you. Or urinary incontinence. Where do they start to find a solution for that?
So the first step would be go to your physician, whether it's your urologist, your primary care provider, and be as open as you can, because if you're not honest and open, we can't help you. And then you might get a medication or ask for physical therapy, be sent over. The first mode of treatment for me is we're discussing, are you constipated? Are you having these other issues that are easily fixable? And then management, because as with everything with therapy, it's not a quick fix. And so if you're wearing a menstrual pad for urinary incontinence, you're probably going to have some issues, because those are very different. So treatment, management, first and foremost.
So a lot of urinary incontinence is maybe different than just some small.
There are many types of urinary incontinence, each having their own group of symptoms. Most people have a combination, but they're all treated a little bit differently.
Okay, so if you're, so when you talk to them and you find out about these causes that can be fixed with physical therapy, then how long would you say, is there any time frame, or how long? You mentioned it's not like that fast.
It's not overnight. The harder you work, the more willing you are to make changes, the quicker the results.
That's a principle of life.
Yeah.
With pretty much everything.
I've had clients who have an extremely improved amount of symptoms in 3 weeks, and for some it takes 2 months or more.
Wow, but how fabulous that there are options. Again, surgery is not a fun thing to go through on any case. And if there's, I mean, I'll be honest, I've never heard of physical therapy for urinary incontinence. So yeah, when I come across this, I'm gonna let people know, hey, check this out. You might be able to fix it easy. Dr. Jessica Baugh, thanks. Wow, why am I having trouble with this?
You're not alone in that. It's okay.
Thank you so much for joining us from the Mountain Valley Regional Rehabilitation Hospital. Wonderful facility in Prescott Valley. All kinds of therapy, physical therapy, and things available there. Thanks again.
Thank you for having me.